Good evening, doctors. Today we are going to do the Neet PG Surgery Challenge, MCQ Challenge. Remember, surgery is a very important subject as far as the PG entrance is concerned. About 25 to 30 questions in Neet PG and about 15 to 20 questions in INSCT come from surgical branch. So let us begin with the first question. Most common cause of small intestine obstruction is A. Intussusception, B. Idiopathic adhesions, C. Tumors. D. Post-operative adhesions. What do you think is the correct answer here? The correct answer here is D. Post-operative adhesions. The most common cause of small bowel obstruction is post-surgical adhesions. The most common cause of intestinal obstruction in adult are intestinal adhesion, which are bands of fibrous tissue in the abdominal cavity that can form after abdominal or pelvic surgery. In children, the most common cause of intestinal obstruction is telescoping of intestine, that is intussusception. Cox's peculiar tumor is A. Basal cell carcinoma, B. Squamous cell carcinoma, C. Ulcerated sebaceous cyst, D. Cylindroma. Well, the correct answer here is ulcerated sebaceous cyst. Cox's peculiar tumor is a sebaceous cyst linked growth that can resemble a squamous cell carcinoma. The proliferating cyst is usually solitary, but it often arises from simple tricholemmal cyst in the hair follicle epithelium. So it is ulcerated sebaceous cyst. False about gastric lymphoma is A. Stomach is the most common site. B. Associated with H. pylori infection. C. Total gastrectomy with adjuvant chemotherapy is treatment of choice. D. 5-year survival rate after treatment is 60%. Total gastrectomy with adjuvant chemotherapy is the treatment of choice. Stomach is the most common extranodal site of lymphoma. It is of two types, primary and secondary. Primary gastric lymphoma is lymphoma of stomach which exhibits no evidence of liver, spleen, mediastinal node, or bone marrow involvement at the time of diagnosis. Primary gastric lymphoma is mainly more than 95% non-Hodgkin's lymphoma of B-cell origin. Most of the primary lymphoma, about 60%, arise in malt, mucosa-associated lymphoid tissue. Malt is usually associated with chronic H. pylori infection, so low-grade malt lymphomas are thought to arise from chronic H. pylori infection. These low-grade lymphomas may later on degenerate to high-grade lymphomas. Immunodeficiency and H. pylori infection are risk factors for B-cell lymphoma. Most common site of involvement is gastric antrum. Secondary gastric lymphoma. Stomach is the most common extranodal site of systemic lymphoma. Almost all of them are non-Hodgkin's type. Treatment: the role of gastric resection is controversial. Recent studies have shown similar diseases free survival, 5-year survival rate in patients treated with surgery plus chemotherapy plus radiation therapy. So correct answer is total gastrectomy with adjuvant therapy is treatment of choice. Which one of the following preservative is used for packing catgut suture? A. Isopropyl alcohol, B. Colloidal iodine, C. Glyceraldehyde, D. Hydrogen peroxide. 10% isopropyl alcohol is the routine packing fluid used in packing catgut suture. Catgut is available in glass tube containing isopropyl alcohol and small quantity of water. Catgut is prepared from the intestine of sheep. So the correct answer here is A. Isopropyl alcohol. The primary hyperparathyroidism pheochromocytoma may be associated with which type of thyroid cancer? A. Medullary carcinoma of thyroid, B. Papillary carcinoma of thyroid, C. Anaplastic carcinoma of thyroid, D. Follicular carcinoma of thyroid. It is medullary carcinoma of thyroid. It is characterized clinically by medullary thyroid carcinoma, pheochromocytoma, hyperparathyroidism. Approximately 70 to 95% of individuals with MEN2A develop MTC, 50% develop pheochromocytoma, and 15 to 30% develop hyperparathyroidism. Meconium miles is associated with A. Cystic fibrosis, B. Infant of diabetic mother, C. Hypothyroidism, D. None of the above. It is cystic fibrosis. Infants with cystic fibrosis have characteristic pancreatic enzyme deficiencies and abnormal chloride secretion in the intestine. that results in production of viscous, water-poor meconium. Meconium ileus occurs when this thick, highly viscous meconium becomes impacted in the ileum and leads to high-grade intestinal obstruction. Which of the following nerve is commonly damaged during McBurney's incision? A. Subcostal nerve, B. 10th thoracic nerve, C. 11th thoracic nerve, D. Iliohypogastric nerve. The nerve commonly damaged during McBurney's incision is iliohypogastric nerve. Damage to this nerve results in development of right inguinal hernia. McBurney's incision, gridiron incision, is commonly done for appendectomy. In this, an oblique incision is made in the right iliac fossa, about 5 centimeter above and medial to anterior superior iliac spine at the right angle to spino-umbilical line. Dysphagia lassoria is due to A. Esophageal diverticulum, B. Aneurysm of aorta, C. Esophageal bulb, D. Compression of abnormal blood vessel. C. This dysphagia lassoria is a disorder of swallowing caused due to vascular anomalies and include a right aortic arch, a double aortic arch, a vascular constricting ring formed by PDA or a ligament arteriosum and pulmonary artery or aortic arch, an abnormal right subclavian artery, an abnormal innominate artery. Diagnosis is made by lipoidal swallow or arteriography. So the correct answer here is compression by an aberrant blood vessel. Surgery for undescended testis is recommended at what age? A. 6 months, B. 12 months, C. 24 months, D. 36 months. It is 6 months. Optimum age for surgery in case of undescended testis is 6 months. The surgical procedure done is called orchidopexy. Early intervention should be considered in order to theoretically prevent the complication of cryptorchidism that may be manifested before 1 year of age. Dacron vascular graft is A. Textile biologic, textile synthetic, non-textile biologic, non-textile synthetic. It is textile synthetic. Dacron graft is a type of textile synthetic graft. It is associated with increased risk of thrombosis due to low flow rate. They are pre-coated with collagen, which eliminate the need for pre-clotting. It is now reserved for aortic and high pressure, large diameter bypass graft and known as aortic endografts. What is the most common position of appendix? A. Pelvic, paracolic, retrocecal, retroperitoneal. Retrocecal is the most common position of appendix. Retrocecal 74%, subcecal 1.5%, pelvic 21%, post-ileal 0.5%. Double bubble sign is seen in A. Duodenal atresia, B. Duodenal stenosis, C. Volvulus, D. All. It is all. Carling's ulcer is seen in A. Burns patient, B. Patients with head injury, C. Zollinger-Ellison syndrome, D. Analgesic drug abuse. It is seen in Burns patient. Curling ulcer or stress ulcer associated with burns and most commonly found in first part of duodenum. Curling ulcer is an acute gastric erosion resulting as a complication from severe burns when reduced plasma volume leads to ischemia and cell necrosis of gastric mucosa. The condition was first described in 1823 and named after Thomas Blizzard Curling, who observed 10 such patients in 1842. So it is A. Burns patient. All are true about amoebic liver abscess. A. More common in females, more common in left lobe of liver, metronidazole mainstay of treatment D, A and B. It is A and B. Indication of liver transplantation are all. A. Biliary atresia, B. Sclerosing cholangitis, cirrhosis, hepatitis. Of course, cirrhosis and sclerosing cholangitis are the indications. Biliary atresia is also an indication. Hepatitis A is not an indication. So correct answer here is C. Hepatitis A. Please click the link in the description box to join the 2-day Neet PG Breakthrough Blueprint class, masterclass, occurring on Saturday and Sunday. Care sign is seen in splenic rupture, in pain over left shoulder, B. Pain over right scapula, C. Periumbilical pain, D. Pain over renal angle. Care sign in splenic rupture is seen in pain over left shoulder. Pain over left shoulder in splenic rupture, the pain may be referred to tip of shoulder. It is known as Care sign. It occurs due to irritation of undersurface of diaphragm with blood and pain is referred to shoulder through the affected fibers of phrenic nerve. Care sign can be elicited by bimanual compression of left upper quadrant. Breast conservation surgery is not indicated in A. Large pendular breast, B. SLE, C. Diffuse microcalcification, D. All. C. Complication of breast conservation therapy include seroma, hematoma, fat necrosis, infection with development of cellulitis or abscess, altered sensation to breast or nipple, close or positive margins, poor cosmetic outcome, lymphedema following sentinel lymph node biopsy, wound dehiscence, especially in oncoplastic technique. So the correct answer is D. All. Mondor's disease is A. Thrombophlebitis of superficial veins of breast, B. Carcinoma of breast, C. Premalignant condition of breast, D. Filariasis of breast. It is the thrombophlebitis of superficial veins of breast. Mondor's disease is the thrombophlebitis of superficial veins of anterior chest wall and breast, although it has also been seen in the arm. Frequently involved veins are lateral thoracic vein, thoracoepigastric vein, and superficial epigastric vein. Etiology is unknown and also known as string phlebitis. It presents a tender cord-like structure. The woman may present with acute pain in lateral aspect of breast or anterior chest wall. A tender cord-like superficial thrombus vein is formed and when the skin over the breast is touched by raising the arm. So the correct answer is A. Lateral aberrant thyroid refers to A. Congenital thyroid abnormality, B. Metastatic focus in lymph node, C. Stoma ovary, D. Lingual thyroid. It is metastatic focus in lymph node. Most common site of CA esophagus is A. Middle one third, B. Upper one third, C. Lower one third, D. Lower end of it is middle one third. Corkscrew esophagus is seen in which of the following conditions? A. Carcinoma of esophagus, B. Scleroderma, C. Achalasia cardia, D. Diffuse esophageal spasm. It is diffuse esophageal spasm. The most common type of tracheoesophageal fistula is esophageal atresia without tracheoesophageal fistula, esophageal atresia with proximal tracheoesophageal, esophageal fistula atresia with distal tracheoesophageal fistula. It is esophageal atresia with distal tracheoesophageal fistula. The best investigative modality for gallbladder stone is oral cholecystogram, percutaneous transhepatic, C. Ultrasound, D. Intravenous. It is ultrasound. Strawberry gallbladder is seen in A. Gangrene of gallbladder, B. porcine gallbladder, C. Adenomatosis, D. cholestasis. It is cholestasis. Diapoma is associated with which syndrome? A. Jollinger-Ellison syndrome, B. Werner-Morrison syndrome, C. Carcinoid syndrome, D. Cushing syndrome. It is Werner-Morrison syndrome. All are resected in Whipple's operation: duodenum, head of pancreas, neck of pancreas, common bile duct, except the neck of pancreas. The tendency of colonic carcinoma to metastasize is best assessed by A. Size of tumor, B. Carcinoembryonic antigen level, depth of penetration of bowel valve, proportion of bowel circumference involved, depth of penetration of bowel. Commonest cause of intussusception is submucous lipoma, Meckel's diverticulum, hypertrophy of submucous pair patch. It is hypertrophy of submucous pair patch.